Dr. Nazia Muhammed Yaqoob, a gynecologist from the Eve Medical Center, for the breast cancer awareness session given to our students from students grade 7 to 12. Now I'd like to welcome them on stage. Can we please have a round of applause for them?
Hi girls, good afternoon. Good afternoon and have a great day and have a good day to all of you here to join us for the discussion about the breast cancer, how to detect early and how to examine yourself. So main focus today for my discussion is not only the presentation, this is mainly the part of discussion with you, and I have to teach you how to examine yourself and how you can detect early if there is any lump or anything. So let's start our discussion. First I'll introduce about myself. I had my post-graduation in Obs and Gynae, MCPS and DOWH from Ireland, Dublin, and MRCOG Part 1 I had done from UK. So still studies going on, we are always in a learning phase, and so let's start our discussion. So I need 10 volunteers even after. So please, in all of you, you have to choose 10 girls who is very active, and we have to make a group, and at the end we have to demonstrate, and we will go as a practical. Right? Agreed?
Yes. Say yes. Yes.
Can you raise the hand? Who are the volunteers? 10 girls I need from each class at least.
All the front girls you can take.
So first of all, I will start from the anatomy of the breast, and all of you know the basic things. The breast is composed of adipose tissues, fat cells, and lobes and lobules and duct, and skin and muscles. Usually notice the part of the breast tissue is on the, you can see, lighter, pointer, I forgot actually. You can see here, this is the chest wall, and this is the pectoralis muscle. Major and minor both muscles is there. These are the adipose tissues. You can see the fat, and there are the lobules, and each breast is divided 15 to 20 lobes, and it's just and inside there is lobules, and each they are opening in the duct, which is lactimiferous duct. So this is the basic anatomy of the breast, and there is lymph vessel as well, and you can see the green channels. These are the lymph nodes. So there are the different groups of the lymph nodes. Central, which is usually in axilla. So I already explained about this. So main our topic is, what is the breast self-exam? Anybody have idea? Anyone?
Switching off the camera. You can't see.
Yes, please. Get up. Yes. Tell.
As far as I know, it's one part of self-examination is checking for lumps.
Yes, thank you so much. Anyone else? Anyone else? Why are you feeling shy? Mashallah, you are confident girls and you know everything more than me, right? Is my voice is audible and clear? Yes. Okay. So anyways, no problem. You can read here, and somebody I need to just read loudly from here. Yes, please.
A breast self-exam is an early detection tool that uses a combination of physical and visual examinations of the breast to check for signs and symptoms of breast cancer. The purpose of a breast self-exam is to become familiar with the way your breasts normally look and feel. Knowing how your breasts normally look and feel, also called breast self-awareness, will help you identify any changes or abnormalities in your breast, such as a new lump or skin changes. Any changes in your breast discovered during a breast self-exam should be reported to your healthcare provider right away. While a breast self-exam is a useful tool for the early detection of breast cancer, it should not take the place of regular mammograms and clinical breast exams.
Thank you so much, my dear. Okay, so I think all of you now understand what is the breast self-examination. This is the part or the tool to examine yourself, to detect any lump or any changes which is normally not in the breast, right? So, but don't think if there is any mammogram or clinical examination should be done by your healthcare provider. or your doctor and not by you. Only you are doing yourself, and mammogram, doctor will decide either you need further screening or not. So what is the advantage? If the breast cancer detected in early stage, it can be cured completely. Our practice of BSc, I will say the short word BSc, like breast self-examination on monthly basis, is a very important for early detection of the cancer. What is the barrier for BSc? Lack of confidence. Because see, mashallah, you are educated, but some women, they are not educated, and even they don't know, and they are not confident. Either they have problem or no. They're ignoring their self. At the end of my presentation, I will share different patients' views, what they think and what they don't want to examine their self and why. What are the reasons? So how often should a breast self-exam be performed? This is a main question everybody asks when we have to check doctor. So every month have to check, and which age you have to start. Once the girl, she started to menstruation, she can start even, but usually from the 20 years of age, you have to examine every month, but the best time after the periods. If the woman has finished her menstruation, if she reaches at the age of menopause. Do you know the menopause?
Yes.
What is the definition? Anybody can tell me, please? Okay, no problem, I will tell you. Anybody can tell me what is the average age of menopause? Yes, please. No, my dear, this is the average age as per UK guideline, currently is 51. Before that was 50 to 55 like that, but now, thank you so much, and 51 is the average age is a UK RCOG guideline. And second thing, and if the patient has, any woman has stopped menstruation for 1 year, then we say she is in menopause, okay? It could be early, it could be late, like that. But of course there are reasons. So we are not going in details for that. So the second thing, what are the methods we have to go for examination? What are the patterns you have to examine? This one slide, I will show you next one, which is showing everything. This you can take even photo, snapshot, and if you want, I will share you my presentation if anybody want. So I'll give you. So first, come here, self-breast examination. Sister, can you come please? Come here, please. Sister will tell you also. Sister Josna, thank you so much. Can you come there and I'll read and you will go. First of all, what you have to do, you have to find some private area or where you are alone and you can examine yourself. Stand in front of the mirror with your arms relaxed at your side. Look for the changes in the breast, such as a swelling, dimpling or puckering of the skin. So you have to see, like sister will show you the posture, how you examine yourself in front of the mirror. Then second, clasp your hand behind your head, press the hands forward and look forward, changes in the shape of the contour of the breast. You have to see if there is any changes. Okay, the third one, what you have to do, continue checking as you press your hands firmly on your side bone, this is the iliac bone, and hunch your shoulders and lean forward slightly. Okay, so then you will feel what are you doing, and if there is any lump, it will be prominent. If there is any dimpling or any puckering, it will be prominent. So you can analyze both breasts, you have to see parallel if there is any changes. The fourth one, don't forget to examine your nipple. And then you have to squeeze the nipple and look for any discharge, any cracking, and any ulcer is there. Raise one arm. If you can do this different posture even in a sitting position, standing position, or lying down. Raise one arm using one or more method. Blow, press firmly with your fingers and feel around the entire breast area of the lump of the thickening. So which area, sister, tell them which area they have to use from the finger. This is the pulp of the finger. These three middle fingers you have to use, not this top. Okay, you have to use this, the middle part of your three fingers. Then repeat the step while lying on your back. Put the hand on the side. Want to examine behind your head. Flatten the breast by placing a folded towel and underneath the same shoulder. You can put the towel, your shoulder, you can lay down, and you have to examine. Vice versa, if you are going to examine the left breast, examine with the right hand. And right with the left, left with the right. And what are the methods you can use? There are 3 methods. Which one I prefer? This one is which method is more preferred, I feel like that. Yani is easy to diagnose and easy you can feel if there is any changes. And linear method, what you do in a line, start in underarm area slowly and move fingers downward until they are below the breast. Move slightly towards the middle and move back up. Repeat over full breast. Circular motion, how you can examine? You have to start from begin at the outer edge of the breast. Move fingers slowly around the whole breast in a circle. Work in increasingly smaller in circle, you see. From the circle you have to start like that. And until reaching the nipple, then you have to examine the nipple as well. The wedge method, how you examine? This is just like a pie you have to make. And start at outer edges of the breast, move finger towards the nipple, like clockwise. You have to go from up to down here, or like in a massage fashion you can examine. Check whole breast covering one small waist-shaped section at a time. Okay? Understand this? This is the most important slide which I shared with you. And the same other one, thank you so much, sister. You can sit. Even this much have courage to show yourself, to tell and teach you. This is the kindness of the sister, and she comes as a volunteer to tell you the postures. I clap you for her, please. Thank you so much. How you can examine, I already explained, so I'm gonna skip. I think you have to be hurry to leave and don't want to listen much. I think, right? No? Are you enjoying? Okay, thank you so much. So this is all 3 I already told you, so no need to do an explanation. So I'm going, another pattern, the sweeping pattern. No need to be palpate. This is, you have to, same, this is the 3 middle finger you have to use, and the pulp of the finger you have to use. Okay? I will demonstrate to you after that. So what are the part of the examination? First is inspection, you have to visualize, and second one is palpation. So inspection, what you will see, breast should be symmetrical, full, rounded, smooth in all portions without dumping, retraction and any masses. Nipple everted, areola should be even and axilla even, and color should be normal and without any mass or any rash. So how to do palpate, what you will see on the palpation, if there is any lump and any discharge or axilla should be smooth, should not be any lymph node. If there is any swelling and you feel there is any nodular structure in axilla and the breast or chest wall, you have to report your doctor. These are the, already I told you, and these are the, sister already explained you. All the posture you see, first one is, she is standing in the mirror, and second she is lean forward. And if there is any mass and it's a prominent thing, it will come up. An examination part, she told you, this one. But during shower, you can examine yourself. This is more easy because it's soapy and it's easy to glide and examine. Okay, during taking shower, you can examine yourself as well. These are the position already I told you. In a sitting position, standing position, or lying position, you can examine. So I'm not gonna go details about the breast cancer type and stages. This is medical, is go in our depth. So I don't want to go for this one. My main focus to be teach you or demonstrate you how to examine. You must be perfect and how to examine yourself, and then you can teach others and how to examine. So as per John Hopkins University, they said the 40% lump is diagnosed by the patients. Because if they know, if they are educated, they have awareness and how to examine themselves, they can diagnose themselves there is something wrong. They cannot diagnose what is exactly diagnosis, but they know there is something wrong. So at least they can go to the doctor after that. So this is the reason, what are the facts. Don't think if somebody has a high risk factors, they are the only at risk for the breast cancer. Any woman, out of 8, anyone can be get breast cancer in her age. Mostly in the old age, more than 55 years of age. So this is the second leading cause of the death, and second most common cancer. The incidence increases with the age. It's usually more than 55 years of age. So don't think like only the women who are at high risk, they are only can get the breast cancer, but the men also can be with the breast cancer, right? But 100 times is more in the women rather than men. So now I want to share you one video. Better at the end I have to share, or now? What do you want? There is 3-4 slides remaining more. Do you want to see the video right now, or you at the end? So you have chips, you have Coke or something, because there is a movie time for 2 minutes, right? At the end. So life after diagnosis. If somebody diagnosed, right, what do you think? What the patient will think? If, for example, one lady came to me, for example, anybody can raise the hand, please? I need somebody here with me. I need like a patient. Yes, my dear. Thank you so much. Thank you everyone for your attention. Come here, my dear. What's your name? Okay, one hug for you. Thank you so much. And just I wanted to know, for example, you are patient, right? Or you came with patient, you are, for example, sorry, don't mind, if one of your auntie, you brought her to me, and you said to me, ma'am, she examined, there is some lump, and she feels there is something, what we have to do, right? You being as a patient, you have to ask me, right?
Yes.
Okay? So, for example, you are a patient, just ask me what you want. Come here.
So, I want to know if so my aunt, she's like having some abnormality to her breasts, and like she felt some lumps in her breasts. What do you think the next step she should take after this?
Yes, my dear, thank you so much. 40% she did her job, and she examined herself, and she detected herself there is some abnormality. The rest is our part, don't worry, my dear, and we are here to support you in all the way. The second step, we have to screen out, and I'll do the clinical examination, and next we will go for some investigation, just like a mammogram or ultrasound, and after that we will decide, and we'll do another investigation, which type of the cancer and at which stage this is. Can you ask this question? Why cancer happened to me?
Why is cancer happening to my aunt? Like, what is the reason she is getting this, this risk at having the breast cancer?
Yes, my dear. Do you have any family history? You told me already your aunt, there is no family history in the breast cancer, right?
No, till now I haven't seen any relative with this.
So, my dear, this is, God forbid, 80%. The women, even they don't have any risk factor, and there is no any chance to get a breast cancer in the life, but every woman at risk for the breast cancer. Unfortunately, your aunt is in this category. This is the 80% women who they are not at high risk, right? So, of course, we will support you all the way. We will attach you in a supportive group as well, and then she will feel better. And don't feel like you are the only one to get this problem. Many women, they are suffering, but not the way. You have to stop yourself. Be courageous and be confident and teach others to save their lives. Thank you, my dear.
You're welcome. Thank you so much for your answers.
So this is the thing I told you. Thank you so much. Thank you, attentive students. And I'm really happy and everybody like attentive and listening. And if you are volunteer and coming to me for the discussion, actually this is not the part of only I told you, many things you can find on internet and you can read yourself. The main thing, how you examine yourself, I'm coming on that now. So that is the reason I asked her to come and answer this question. So of course, somebody diagnosed and then life will be changed. It's not easy to, is a big impact on their life. Social life will be changed, our daily routine will be changed. They will feel sad, like who has responsibility to support them? Not only the doctors, not only the healthcare professional, you are the young generation, you are also. So that is the reason why I'm here, to teach you and you support others who they are suffering, okay? So next, breast cancer, why me? She asked me the question. See, I told you there is about the most obvious risk factor for the breast cancer is being a woman. Men get the disease too, but it's about 100 times more common in the women. And other things that make it more likely include being over age 55, having close relative who had the disease. It's still up to 80% of the women with the breast cancer have no family history of the illness. I think you got your answer, right? So some slides I put only to, you have to see there is a lump and hard knot or any thickening inside the breast or underarm area. Swelling, any warmness and redness and darkening of the breast, and you have to report to your doctor. If any changes in the breast size, you see the right and left, these are different size. So any dimpling and puckering of the skin, then you have to, of course, consult with your doctor. This is another one. If you see any nipple discharge, any cracking, any ulcer, any rash, any scaly skin, have to, of course, report to your doctor. If you feel there is any pain is in a particular area and is not going to be subside after taking any medication, then you have to consult with your healthcare provider. So what are the risk factors? Anybody can read for me, please? Yes, please come here. Come, yes, fast. What's your name, my dear? Isha, thank you. Clapping for her. Thank you.
So, risk factors: increasing age, genes, family history, radiation exposure, dense grease tissue, obesity, alcohol consumption, gender, personal history of breast cancer, early menstruation, late menopause, having a first child at an older age, never being pregnant, hormone therapy.
Thank you so much. So there is something, wait, don't go here. What do you think about the genes?
It may be
There are different genes, BRCA1, BRCA2.
yes, right.
If there is any mutation in these genes, and there is a more risk for the cancer, right? So what do you think about dense breast tissues? If somebody has dense breast tissues, there is a 4 to 5 times more chance to get the breast cancer. So can you tell me about the gender? I told you how many times it's more in the women rather than men?
It's more than men. I mean, the women are more
100 times.
yes, more 100 times than men.
Yes. What do you think about the early menstruation?
Early menstruation is before like
Age of menarche.
Yes,
Before the age of menarche.
Yes.
Okay. So I think as the late menopause, I told you the average age is 51. Okay. And hormone therapy, what do you think about the hormone therapy, my dear? Anybody else? Thank you so much. No, not this one. This is hormone therapy. This is something else. That is the reason. That's why I asked you what is written here. Hormone therapy. The women, if they are taking any HRT, hormone replacement therapy, after their surgeries, like uterus has removed due to some reasons. So I'm not going to details for these things. So for hormone replacement therapy, HRT is called HRT. If they are taking HRT, then they have to discuss with the doctor. They have to ask for how long they have to take and what are the side effects. If I am at a high risk, for how long I can take or I cannot take. Okay, dear. Thank you so much, my dear. Thank you. So there is a conclusion, and there is 4 points I'm going to conclude. Then first of all, you know the risk. What is the risk? For example, I told you the risk factor before, right? So what do you think, for whom you have to discuss? Anybody tell me? Okay, there is any 2-3 risk factor you find in your family, right? Anybody else, please raise the hand. Anyone? Not you. Who already finished? No, not that one. Anybody else? You, my dear, please. You. Green one, yes. What's your name, my dear? Yes, come. Don't shy. Both come. You also, my dear. You. Both come, please. Two girls I need. Oh my God, I'm not scary, my dear. I'm very friendly. Come here, both of you. A smart girl. Okay. For example, one big girl also I need, please. It's gonna be finished 2 slides more only. Anyone else, please? Grade 11, 10, 12. Teacher, please choose somebody. I don't know their grades. Why you are shy, my dear? Why are you feeling shy? No problem, come. You come, please. With the glasses one, can you come, my dear, please? Come. Come, you're looking very smart, by the way. Come. So for example, and all of you, I ask you the question, just listen carefully, please, okay? What's your name, my dear?
Nia.
Okay, Nia. Nice name. What is the meaning of that?
Sunshine.
Thank you, sunshine. So you have to shine in all of them today, okay? So clap for her. In all of you, she is confident and she came out. I don't know how it's open.
It's not working. Just shake.
Okay, tell me. I told you the risk factors, right? You find in your family. God forbid, I'm sorry, huh? Just we are gonna do demo only. There is 2-3 risk factor you find there is in a family history of the breast cancer. What you have to do? What is the question come in your mind? What do you want to ask the doctor?
Like, I don't know. Maybe like,
For whom you want to discuss? Tell me. For whom you want to discuss?
doctor?
Okay. Anybody else? Rather than doctor? Before doctor, anybody else?
Mother?
Okay, my dear, the same question from you. And if in any family history in your in family, somebody has a breast cancer, ovarian cancer, any cancer history. So for whom you have to discuss? If something is coming in your mind, for whom you want to ask? And you examine yourself, you find something abnormal.
We can ask to our family member who already happened with them.
Yes.
And after that, we can say to them to go to the doctor to just ask.
This is you, my dear.
I will ask my mother first,
Yes.
and then I will ask that if there is anyone in the family who had this, so I can get some information about that.
Thank you so much. This is the thing I want to listen. This is the 3 thing. Thank you, all of you, my dear, and God bless you. Just have a seat. Thank you. So the main thing what I wanted to ask actually, if you have any lot of question in your mind, I will ask you in the last one, okay? Just wait a minute. So I will call you, my dear, in the next question. So first, if you know the risk factors, if you find any risk factor, you have to discuss with your family or somebody who is close to your mother, sister, anybody. Okay, then with the doctor. You have to talk with them. The next step, get screened. Talk with the healthcare provider about which screening tests are right for you if you are at higher risk. And what are the screening method we have to go? Mammogram and clinical examination. It should be done by the doctors, not you. Okay? So last, and yes, my dear, can you come please? What's your good name, my dear?
Lena.
Hi, Lena, how are you?
I'm good. How are you?
I'm good. Just dear, you have to read and you have to conclude my presentation. Just read this slide, please.
Know what is normal for you and see a healthcare provider if you notice any of these breast changes. Lump, hard knot, or thickening inside the breast or underarm area. Swelling, warmth, redness, or darkening of the breast. Changing in size or shape of the breast. Dimpling or puckering on the skin. Itchy, scaly, sore, or rash on the nipple. Pulling in on the nipple or other parts of the breast. Nipple discharge that starts suddenly. New pain in one spot that doesn't go away.
So, okay, 1 minute. See, just you see, you already explained the things, and your colleague, Lena, be with me for some time, please. So, can you come here? Can you show me where is the lump in the first picture? Why you can't see? Anybody can see the lump in the picture? Come here. If anybody point out one lunch from my side, okay, next week. Outside somewhere with me. Who can find out the lump there? Yes, please come. Just point out where is the lump. Come, go. You can go also. You can see. Okay. Yes, thank you so much. Tell them there is. Okay. So this is, you can see, this is the prominent part. If you will lean forward and hunch your shoulder, then in front of the mirror, you can see yourself if there is any lump, right? This is actually is an advanced stage. There is a redness, and second she told you puckering and orange peel appearance is like that. Okay? Say, what is this, my dear? Anybody can tell me? An axilla? You feel there is some lump, right? But it could be, the breast itself, they have the axillary tail. It could be the cancer at the axillary tail. Okay? And maybe this is the lymph node. So next I will read. Thank you, my dear Lina. Have a seat, please. Yes, it done. Just a minute. It could be recurrence. And even after treatment, she asked me if one time cancer is happening, it can be recurrence. Yes, it can be. Yes, it can be. It can be. Not like that only one side, it can be the breast cancer, it can be another place. And if you get the even treatment, and there is a chance of recurrence as well. Okay? But if you detect early, there is 100% cure, my dear, more than 98%. So why the reason? If you detect early, you can save the life. So you are the part of this, even you can be a part of the volunteer. For different organization, you can find the resources. There are the different research papers. You can go there and you can register yourself. Thank you, my dear. Okay. So the last one, this is the fourth point. How you can prevent yourself with the breast cancer. How you can prevent. Anybody can read, please? Last 4 points. I have to find somebody. Who is hiding? Who is hiding? This one, my dear. The glasses one. Center, please. What's your name? Yes, my dear. Come fast. No time. Hurry up. Come both. You have to come. Sit here. I will call you. Sit. Can you read for your friends?
Conclusion court. Know what is normal for make healthy lifestyle choices. Maintain a healthy weight. Make exercise part of your routine. Limit alcohol intake. Limit, Miss, what's the reason? Menopausal, hormonal. Yes. Okay. Breastfeed.
Thank you so much. So make healthy lifestyle. This is your choice. Everybody know the BMI. Am I right? Everybody know the BMI? How to calculate the BMI? Anybody can tell me? Yes, please. Yes. So what is the normal BMI for normal person? 25. 18 to 25, like that. Then we have to decide is obesity 1, type 2, 3, like that. Okay? So you have to maintain your healthy BMI. And you have to do regular exercise. If somebody is taking alcohol, they have to stop alcohol. And if anybody taking HRT, they have to ask their doctor to reduce or for how long they have to take. So my dear, this is one very important slide. I'm gonna read one by one. Okay, first I think we have to finish the video. Then I'll go for that one. What do you want? The video, this is the last slide. You want this slide now or video at the end?
Video.
Just raise the hand. Who want video?
Raise your hand.
So at the end, who want at the end? Video?
No one.
Tell me. Just raise the hand who want video right now. So okay, no problem. I gonna start. I think lesson. So we have to finish the slide first, then I start the video. No problem. So please be focused on this slide, which is very important. This is the common question the patient come to us. Yani, I know what they think and what they want. So first they see, if you ask somebody if even they have problem, they will ignore. Why? I am a busy parent. What do you think if somebody is a busy parent, they have to ignore their health?
No, not at all.
So you should prioritize your health so I can be a parent for my kid, right? You have to promise yourself, if you give priority to your health, you can be a healthy parent. Then next, if you ask somebody, say, no, doctor, I am afraid to go to the bad news and I don't want to listen any news which is not good for me, I am sorry. So, fear for receiving the bad news would not make it go away. It's best to be proactive about my health. You have to promise yourself. The next, a well-woman exam is uncomfortable, a mammogram is painful. If somebody said this is uncomfortable mammogram, one of my friends, she told me, no, this is very painful and I don't want this uncomfort. What do you think? Anyone can answer, please? What you will promise yourself if you will be the same question here? What will be your answer? Can anybody can read, please, loudly? Last slide. So I can withstand a short amount of discomfort. Regular exam will give me the best chance at the early detection. Okay, so you have to promise yourself, I don't want to inconvenience anyone by taking time for an appointment. So your health is priority and health, this is, of course, is worth it. I can't afford the mammogram. This is not the reason. There is many resources. They can go by, on the charity basis, they can go free investigation. I don't feel comfortable with my doctor. Oh my God. I can advocate for myself. Have to promise yourself. I can advocate for myself until I find a doctor I feel comfortable with. There's 3 more questions there. The women in my family don't prioritize breast health. So what will be the promise? I am in charge of my health and can set a healthy example for my younger generation. The third one, the second last question, I don't know how to do a breast self-examination or what a breast lump feel like. This is a lame excuse, by the way. If you want to learn, you can get the resources. It's easy to forget to the breast self-exam. Anybody can forget the food? Your dinner, lunch? Tell me please. Of course no. So how you can ignore your health? So you have to put or set the alarm, you put in the mobile or any notebook and you can examine every month. Okay dear? And thank you so much.
Good afternoon and Assalamu alaikum wa rahmatullahi wa barakatuhu. I thank Dr. Nazia Muhammed for a wonderful presentation. It was a great learning, ma'am. I would like to say the only person who can save you is, can you fill? The only person who can save you is you. Do you understand?
Yes.
And I would like to state Helen Keller's quotation, optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. We will see a live example of confidence and a cancer patient who is among us. That's a surprise, but after the appreciation. I thank Dr. Nazia Muhammed Yaqoob for the wonderful presentation today. Thank you very much, ma'am. Kindly accept our certificate of appreciation as a token of our love. Thank you.
And I want to say especially thanks to all the girls, and they are very lovely and very dear to me. and thank you for your cooperation and concentration, and hope so you learn a lot.
Stage, one of the most inspirational parent, the name of the parent is Miss Nazia Sultana. Miss Nazia Sultana is the mother of, you know your child name? Mohammed Hamdan Tawfiq. Grade 2C. Grade 2C. You can face the audience, ma'am. Miss Nazia Sultana will share few words about her journey, and she's still suffering from cancer, but still look at her confidence and hope. A big hand for the parents.
Assalamu alaikum. Good afternoon, everyone. I would like to thanks to the Bloomington Academy School who invited me to the participating to the breast cancer awareness program, and I would like to share some few sentences for you. I'm not taking your too much time. Cancer is a simple word, okay? Is when the cancer cell is our body grow, multiply, form tumors, and start destroying your cells from within. That being said, not all type of cancer are curable. Breast cancer, for instance, is one type of cancer that is widely cured. Only early diagnosis and treatment are crucial and help in preventing the spread of cancer and saving lives. If it is diagnosed at an early stage, it could be treated as a fraction of a cost as compared to when diagnosed at an advanced stage. Therefore, as a responsible citizen, we should take care of ourselves. We should also make our family, friends, and other people around us aware of it. Remember, if you want to fight for your life, you have to follow some life of rules. This is the great regular checkup you need, and eat healthy, stay safe, and stay healthy. Thank you so much for everyone.
And give certificate to our parent, Miss Nazia Sultana. Miss Jasira. Some of the students who are sitting in the first row, you can join.
God bless you, my dear.
The first row, few students. With all others, we'll take a selfie.
Come to come here. Just now, when you take one selfie, please see her. Come here, take with this. With this. Take one. Thank you so much. Thank you. Thank you.
I request once again, I'm sorry, I'm making you do a bit of exercise, up and down. I request Doctor to come again on stage along with the marketing manager and other team members for a photograph. Ms. Afni.
Please come.